when you walk in saying, I need morphine,
they're like, wait a minute.
Sit down. Like, no. And then they're immediately very resistant to that.
Welcome to Sickle Cell Sundays. Today we have an exciting guest, Dr. Shauna Higgins. She did her undergraduate studies at Brown University, completed her medical school at UCLA. She trained at Yale and completed her residency at USC and LA County Hospitals, where she was also chief resident.
Good job.
Thank you. Thank you for agreeing to do this podcast today. I think it's very important that we, discuss different subspecialties like dermatology, because sickle cell affects different parts of the bodies in different ways. So I was excited to bring a board certified dermatologist on today's episode. So I feel like the first time that we discussed sickle cell was when I was asking about the spider webs.
Yes. I was going to ask if you remember that.
I do remember that. And I always forget the name. So there was a spider web pattern on my legs. I was using my heating pad a lot. And I asked Dr. Shauna, what is going on? Can you tell the people what that was? Because I forget the terminology every time.
Yeah, so I feel like a lot of dermatology words are really hard, but it's called erythema ab igni. And it's funny because there's a few things in dermatology where you walk in and someone shows you something and you really know exactly what's going on.
Yeah.
And so that for you, I think you had told me before that point that you had sickle cell. So I already knew. And then when I saw that, I was like, have you been using heating pads?
Yep.
And so it's pretty common. It went away by itself, right? Once you stopped using your heating pads.
It eventually faded.
But it's really common in people who use heating pads. You see it on the low back. You had it on your legs.
On my legs, because my legs were hurting a lot.
Exactly. And so it has to do with the blood flow and like the vascular dilation. And when the blood moves a little slower, you can kind of see the outlines a little bit more.
Yeah.
But it happens a lot in people with sickle cell, and they have no idea
what it
is, why it's there, what to do about it, if it's going to go away. But that was a quick and easy fix. I think you asked me that like at the end. You're like, by the way, what's this? And I was like, oh, don't worry about it. This is what it is.
Yeah.
Have you had it before?
Yes, but it was funny because I asked my regular doctors, like, what is this? And they're like, they didn't know. And I was like, well, why don't you know? And it was funny because when I posted about it, there were other sickle cell patients that were like, when you find out, let me know. And that's when I asked you. Yeah. So eventually I just would let it go whenever it would happen. Yeah. But when I posted about it and other warriors were like, let me know, because I get that too. I was like, oh, this is good to find out.
It's interesting because there's a lot of stuff that I guess we study that is not, I think it's because it's common to us.
Right.
We think
it's not common to a regular doctor.
But we forget that it's not common knowledge to everybody. Right?
Yeah.
And so I love that. I love that we were able to fill in that little gap for you.
Yes. Appreciate you. Do you feel like you see a lot of sickle cell patients in your line of work?
So now in clinic, not as much, but in residency, I saw a lot, yeah. And a lot of them had the same exact rash that you had. Interestingly enough, my mom has never had that rash.
Oh, wow.
But honestly, she doesn't use a lot of heating pads. She's stubborn.
Yeah.
She just doesn't treat herself.
Right. And as you bring up your mom, as the big topic of why we're also here today, when was the first time that you saw her have a sickle cell crisis? And what was that like for you?
The first time, wow, I don't even remember I have to think back. It was when I was probably really young. I was able, I think the youngest, when I realized what was happening, I was able to drive, and I was the one that had to drive her to the hospital.
Yeah.
I think I was newly driving though.
Okay.
really know how to drive that well.
Right.
But my mom is, because she's been dealing with it her whole life, and she grew up in Belize, and they didn't know what was wrong with her in Belize. She was just like, she's one of 8, and she was just like the special one who always, her dad had to like rub her leg, and she got like special attention, and they didn't diagnose her with sickle cell until she moved to the U.S. when she was a teenager, when she was like high school age. Yeah. But when the first time she had a crisis that I remember, she was just like in her room for the longest time, because when she has pain, she just kind of like goes and deals with it. She doesn't tell anybody. She doesn't tell anybody until it's really, really bad. Yeah. Because she just tries to like work through it. And then so she told me, and it was only me and her home, and she's like, you have to take me to the ER. And I was like, oh shoot, I don't know how to drive that good. And so I just remember putting her in the back seat, and she was laying down. She was like moaning, and I was like nervous because I didn't know how to drive that well. Plus my mom is like moaning in the back seat. And I'm trying to make it to the doctor, and I don't know what to tell them. It's my first time. She can't even really talk at this point.
Because of the pain.
And so I had to tell them, and she had told me before. She's like, if you take me, tell them I need 1, 2, and 3. And then so I went and I told them, I said, excuse me, my mom needs morphine, oxygen. And they're like, okay, but she has to wait. And I was like, no. Yeah. Like, we've already waited. She's at the point where she can't wait anymore. Yeah. And that was the whole thing too, because I mean, with pain and pain seeking, like medication, opioids, like the whole opioid issue right now, like people are really hesitant to give out pain medication. Yeah. But in this context, it is super important, especially for her. I try to tell her to go before it gets to the point where she cannot wait ananymore, but she doesn't listen to me. Yeah. And so we end up going when she literally cannot wait anymore. And then we end up, luckily, like, I'm a physician now and I can kind of talk to them about it, but before they wouldn't really like listen to me when I try to tell them. She, like, when you walk in saying I need morphine,
they're like, wait a minute.
Sit down. Like, no. And then they're immediately very resistant to that. And then as a physician, I understand why, but there's certain conditions where you really have to listen to the patient, and this is one of them.
Absolutely. Yeah. And to your point about how she never goes to the last minute.
Is that you too?
That is. But
why are y'all like this?
From a caregiver perspective, I think you guys all have that same, like, go before it's too late. But from the patient side, I think it's one of those things where you have to.
From the patient side, tell me why. From the my mom doesn't tell me.
From the patient side, I would say it's more so. When you go to the ER, it's like uncomfortable. You're dealing with weight. Sometimes you deal with providers that don't understand.
Is your pain not uncomfortable?
It's we're so used to the pain that we can tolerate it to a high level. And so, but by the time we're like, okay, we're giving in, we're gonna go to the ER, that means we've done everything at home and we just absolutely can't. But if
then that makes it so.
It does make it hard.
We're like, we feel so bad
because you can't do anything.
We can't do anything, and you're like writhing in pain and moaning in pain, and then I can't do anything but try to get you there faster with my little driver's permit. I'm like, oh Lord, this is stressful.
Yeah, it's one of those things where like you balance how uncomfortable do you want to be? Do you want to suffer in the comfort of your home in your bed? Or do you want to suffer in the ER's waiting room, in the lobby, in the hallway? It depends on the day.
My mom is the same way. She's like, I'd rather be at home versus waiting and in the hospital. And she hates being admitted because she's like, I can't sleep here. They come and they wake me up.
All hours of the night.
So she'll like, when she's in the hospital, she'll call me in the middle of the night. I'm sleeping. I feel bad because I can't answer, but I'm sleeping. And then I get voicemails from her in the morning, like from literally the middle of the night. And she's like crying on the phone because she can't sleep and they didn't come give her pain medication. The things are beeping. They come draw blood at 4 a.m.
Right. It's the most inconvenient times that they draw labs.
Literally. So it's a combination of the pain plus like the environment is really not, and that's the thing with hospitals. It's just not conducive to just like healing.
Right.
There's too much noise and too much stuff going on.
Yeah.
And then also they're not, I don't think they're on top of pain management all the time the way they need to be. Like when she calls me in the middle of the night, like crying, then I have to
advocate for her.
Exactly. Because she thinks that they're doing as much as they can be doing. And I'm like, no, at this point, you've been in the hospital for 3-4 days.
Enough.
Like, your pain should be better controlled by now.
Yeah.
And I have to be like, okay, well, do they have pain management?
Right.
Like, working with you?
Is there a specialist there? Yeah.
And then she's like, no. Well, I'm like, okay, well, you need to tell them that they need to get pain management and they need to get your pain under control.
Right.
You can't be going on like this 3-4 nights in a row, like bone breaking pain. That sounds miserable. I couldn't imagine.
No. And it definitely makes all the difference when there's a pain management specialist there, because they're more likely to give you what you need versus the regular hospitalist.
Exactly.
Like I remember last year there was a time where I was just having the worst pain ever, and I was at one of the hospitals that I don't prefer. And
y'all have preferences too.
We definitely have preferences.
My mom, my cousin, you guys have preferences. Like this hospital, not that one.
Yes, for sure. And it's like I was there and the pain was not going away until a pain specialist came, and she was a Black woman, and she was just so, empathetic and understanding. And she was like, she needs a PCA pump. And it made all the difference. And I was like, they couldn't think of this before. So yeah, it definitely makes a difference. They're not. And there's some hospitals that are not able to, take care of you the way you need to be taken care of. Now, you say your cousin also has sickle cell.
Oh, yeah, he has it a lot worse.
Really?
Yeah.
And how is his management? Like, how often is he in the hospital?
So he has it significantly worse than my mom.
Okay.
And so he has had throughout his life like a really hard time keeping a job.
Yeah.
Because he's always in and out of the hospital so much.
Yeah.
And so I think now he does like part-time stuff, and I think he's like on disability a lot too.
Okay.
But there was a time where we thought because he needed transfusions all the time. He was at a point where they said he needed like a transplant.
Oh wow.
Otherwise, he just wasn't he was just having too many complications.
Yeah.
But he's doing okay now.
That's
good. But he's still in and out. It's honestly just life for him now. Yeah. He's not fazed by it anymore. Okay. He's just in and out of the hospital. Yeah. It's very normal.
It's like his routine.
It's his routine. It honestly has affected the way he goes about his life. Yeah. When I tell you, like, you can't threaten that man. You can't threaten that man, because he's like, he will hit you back with, well, I'm already in XYZ amount of pain. Like, there's nothing you can do to me. There's nothing more you can do. Yeah. And so he has zero fear the way that he lives his life. And he's like, okay, well, do you? But I mean, it's like, it's positive in a way that he doesn't hold back at all. Right. But it kind of sucks where it came from, you know what I mean?
Right. Oh man, that's a lot.
Yeah.
How do you feel like you and your family cope with the unpredictability of sickle cell between your mom or your cousin?
I think we're, like you guys get used to it, I think we get used to it too. It's like a sucky thing to have to get used to. Yeah. But it's just something that becomes part of life. I think, me and my sister both know what my mom can and cannot do, places she can and cannot go. Yeah. Like we can't really, we know that we can't go to high elevations with her and just expect that she's gonna be okay.
Right.
Like when we used to go camping a lot. We used to go to the mountains a lot. And with high elevation, because there's less oxygen, like she inevitably starts having pain.
Yeah.
And so we just adjust. Like if we're gonna go somewhere like that, we're not gonna go for more than like an overnight situation.
Okay.
We make sure she brings her pain medicine just in case. Like we just plan around it.
Okay.
And so, I mean, even when we travel long distances, like at this point, she's probably, because we've been talking about taking longer trips, because she's not gone on like more than a 7-hour flight before. Mm-hmm. So we know that if she goes on a longer flight, if we go on a big trip, she has to take oxygen with her.
Yeah.
So you just plan around it, honestly.
Okay. That's pretty good, though. Like, you're more proactive now, you would say. Mm-hmm. Do you feel like there was ever a period where mentally, like, it just took a lot on you?
I mean, mainly when I was younger.
When you were younger?
Yeah. Now that I'm older, I feel a little more well-equipped to deal with it, especially, like, with the knowledge that I have.
Yeah. What is something that you wish the older you could tell the younger you in preparation of being a caregiver for your mom?
That's a good question. Gee, you were proud. I didn't even have to say that was a good question yet. She was already like,
you ate that thing.
She was proud of that question. Let's see. I would say, number one, don't panic, because I remember when I used to be trying to get my mom to the emergency, like when I was younger, I was a little panicked because I didn't want her to be in the pain that she was in.
Right.
I didn't know what I needed to do and how to do it to help facilitate what was needed to happen.
Yeah.
But like I said, she did tell me already, like when we get there, this is what you tell them that I need. So I had everything that I needed. It was just, it was very, it felt a little chaotic.
Yeah.
So I would just tell myself to be calm, because we'll get her to where she needs to be.
Right.
And then also make sure that you really advocate for her. And I think that I did, but I think that as a kid, you don't want to push too much, because who are you? You're like this little kid.
Yeah.
But you know a lot more about this condition and what is required to treat it.
Yeah.
Just from personal experience than someone who's just meeting her.
Right.
And so just have that confidence when you go to the doctor and talk to people about what she needs and help her advocate when she can't speak for herself.
Right. That's a good one. We're coming towards the end. I have a few more questions.
Do I get to ask you questions?
You can if you want to, absolutely. Towards the end, I always ask, is there anything you want to ask me? Let's see. Do you feel like your experience with sickle cell and your mom has influenced any of your interests or career goals?
I would say more than anything, it has encouraged me to just really listen to people. Because I think as doctors, you think you always know what's best for people.
You guys are hearing it from a doctor.
And I think there's, I mean, yes, we've learned a lot, right? But there's a personal lived experience component to all of this.
Right.
And I think that doctors get into this trap of getting kind of in autopilot. It was, okay, I see this is what this person needs. I see this is what this person needs. It's very like algorithmic. And I think you kind of have to actively take yourself out of that and really listen to people and hear where they are and what they specifically need, because even if it's the same condition, that's going to be a little bit different for everybody. For example, my mom and my cousin have the same condition, but their needs are very different. And if I walk in the room and I'm like, oh, you have this is what you need, it's not going to be enough for my cousin, it might be too much for my mom.
Right.
And so you just have to really listen to people. And I think that's one of the bigger things that I've learned, because I've been on the physician and the patient side of this situation and have seen the breakdowns.
Yeah.
And so I think a lot of the breakdowns come from people just not really like hearing you.
Yeah.
And you gotta listen.
Listen. That is the most beautiful answer. I appreciate that. As a patient, I truly do. And it makes all the difference when someone is not only knowledgeable, but also listens. Like, those two combined, a force to be reckoned with. So my final question would be, what advice would you give to other family members or other, children of those with sickle cell?
Number one, I would say I understand where y'all are coming from. However, I would really stay in tune, and check in and encourage y'all to be more proactive.
Yeah.
For example, for me, my mom will not tell me that whenever her pain starts, she will not tell me.
Okay.
But if I'm paying attention, I can tell when she's having pain, because she starts kind of rubbing her leg like this, or she starts getting a little more fidgety.
Yeah.
And so if I pay attention and I ask her, hey, are you having pain? Then she'll be like, yeah. And then we'll talk about what we need to do.
Okay.
But she won't volunteer that unless I ask her. And so I would say just try to pay attention. I feel like you guys also don't want to be burdensome.
Yes.
And so I feel like that's where some of the hesitancy comes from. But just, I think, as a family member, communicating to your family member with sickle cell that it's not burdensome.
Yeah.
We care.
Right. That's true.
And we want to make sure that you guys are not uncomfortable.
Yeah.
And that's what family and friends are for. We're here to help in these moments.
Right.
And so it's not burdensome at all.
Yeah.
It's really helpful to have you guys communicate to us when you're not feeling comfortable.
Yeah.
But I would say, as a family member, also important to pay attention. And then also, like I said before, just don't be afraid to advocate for your family member who has, because it's one of the conditions that requires the most advocacy. Yeah.
Absolutely. I completely agree. Before we close, is there anything that I haven't asked you that you would like to ask me? Is there anything that you would like to add that you maybe want to expand on more? It's your time now.
My time? I have the floor?
Yes.
I want to know how it's affected your life.
Yeah.
That's a big question, but...
No, it's a real question. I would say, how is it?
You guys are very cavalier about it.
Yeah.
No biggie, but it's a...
Yeah. Yeah, I think it's hard because when you get so used to it, it's like, oh, this is your normal, but it's not normal.
No.
It's definitely given me PTSD in a way, because it's like you could be enjoying your life. Like, this year has been great. Last year was miserable. And you don't know when that flip is going to switch and you're back to being miserable again. So I definitely am always trying to live life to the fullest and do the things I can while I'm here.
Yeah.
So in that way, trust. I don't trust people as easily. And also, I think it's more so just because I've sheltered myself a lot throughout life. More so because growing up, I spent a lot of time in the hospital and it was just me. And then I'm also Nigerian. So in our culture, there's not an openness of discussing what you're feeling. And I wish younger me knew enough to advocate for myself and say, hey, can I get therapy? Because I think it would have made all the difference. Because being a kid that loved having friends, doing things, but not being able to always do those things, it made me keep all those things in my head. So I think until college, I didn't really start opening up. And so I went my entire childhood with all the feelings of what I went through, I kept them.
But do you feel like that was more cultural?
I think it was a mixture. So for me, like, there was a period when I hated God.
Oof.
Right. There was a period when I hated God, and
but I can get where that comes from.
Yeah, and it was more so just like, I'm a kid.
Right.
I haven't
dealing with all
I haven't done anything yet. Like, you know, for me, I looked at it like I'm innocent.
Right.
I haven't wronged anybody. I don't feel like I did anything to you, but here I am suffering. And if you exist, why am I suffering like this?
Right.
And so if the main person that you should trust, you feel like you can't trust, how can I trust other people that are actually living and walking on this world?
That makes a lot of sense.
So yeah, so that
makes a lot of sense. That's heavy.
Yeah.
How did you get over that?
Or
are you over that?
I am doing a lot better. My relationship with God is, oh my God, so much better. It's been growing for a long time. Like, I credit like my pastor that I had in Philly for a lot of my growth. My cousin Florence, who's helped me a lot. Like, friends that are in the Word that have helped me, and just looking like. I think one of the hard things is knowing that, like, I understand why he gave it to me now.
I was just about
because
to say,
the spirit that I have and the way I bounce back, everyone's not like that. And because of who I am and the love that I have, I'm able to use my voice. I've been able to help other people find their voice. And it's like, I get why you picked me, but oh my God, you couldn't pick somebody else? So,
but you were the one.
Yeah.
You were the one. I get where that came from, but you just would not be you without all of it. You wouldn't have like the same resilience, the same grit, the same character. And then you get to, like you said, you get to be an example of motivation for other people. So it's like a blessing and a curse.
Yes, and I say that often. That's exactly what it is. So you take the good with the bad.
Yeah.
But yeah, I'm here, still standing.
Exactly. And I feel like the majority, I mean, just from my experience with the three of you, you guys are all very positive about it.
Thank you.
At the end of the day, you spin it and you reframe it to be like a positive, like motivating force.
Yeah.
And I think that's really beautiful.
Thank you. I appreciate that. That was a great question.
Of course.
Yeah.
Yay.
I think that was really good. Anything else?
Not really.
Yeah.
Not really.
I really appreciate you.
That.
Thank you.
Likewise.
I tried. So that concludes this episode of Sickle Cell Sundays. Thank you for watching or listening. Please like, comment, subscribe, and share with your friends.